until I started cursing people out. That's when they called my doctor and said, let's do a CAT scan. I was hemorrhaging. I almost died. When they opened me up, they said I only had 2 pints of blood left in me. I had bled for 2 solid days. I had to curse people out to even listen to me. I'm like, this is not gas. I'm about to die. I have 2 children.
Hey guys, welcome to another episode of the Being Rare podcast, where we talk about all things rare disease. Today we are talking about being rare and Black, a conversation about navigating life with rare diseases as rare caregivers, as people of color. First and foremost, I have to acknowledge all the bossness in this room. Ladies, please, let's raise a glass to the bossness. Yes. Thank y'all so much for hanging out with me. So let me do some really quick introductions. To help me with this conversation, we have Dionne Stalling, who is the founder and executive director of Rare and Black. We have Georgene Glass, who is the founder and executive director of DreamSickle Kids. And we have Stacey Brown, who is the founder of Wombless and Worthy, and she also works with Beautiful You, the MRKH Foundation. Ladies, welcome to the Being Rare podcast.
Thank you. Thanks for having us.
Thank you.
Yes, I am so excited to have y'all here. All right, so we are going to jump right into this conversation because we have a lot of information we want to talk about, a lot of things we want to cover. First and foremost, I want you guys to just do a really quick intro of yourself and your relation to rare diseases, just so the folks know who we're talking to. So I will start with you, Dionne.
I'm Dionne Stalling. I am a rare disease patient with 9 rare conditions. I have small bowel syndrome. I have primary immune deficiency. I have chronic inflammatory demyelinating polyneuropathy. I have central serous retinopathy. I have mitral valve prolapse syndrome. I have hidradenitis suppurativa. Did I say primary immune deficiency? I have 9. I keep them in my phone for my doctor, but y'all get the gist of it.
Wow, man.
So Rare and Black because when I got diagnosed, I had a 45-year medical odyssey. I got diagnosed with my first rare disease at the age of 45, and I went to Google University. And what I'll say is, after not having a doctor that was curious enough to treat me for maybe about 4 or 5 years, he finally said, I don't know what's wrong with you, why these wounds aren't healing, why you're dealing with all of this. Let me refer you to an immunologist. And I was referred to her. I sat in her office for 7 minutes, and she said, I think I know what's wrong with you. I'm going to give you have you ever had a pneumonia shot? And I said, no. And she said, I'm going to give you a pneumonia shot and a flu shot, and I'm going to draw your blood. I want you to come back tomorrow, and I'm going to draw your blood. And on November 12th of 2014, she told me I had primary immune deficiency, and I have 2 of the deficiencies. One is common variable immune deficiency, and the other is subclass IgG deficiency. So when I went to Google University and typed that in, I came across an organization that I worked diligently for as a volunteer for a few years. And in certain spaces, I would find myself the only Black person. And just doing little things, talking to people and things, I felt that there was something lacking in the space that didn't answer to my people. And I started Rare and Black. Rare and Black was founded on March 12th, 2020, right when the pandemic hit. Oh, and which brings me to another rare, because my son's ship was that ship with all the sailors with COVID in March of 2020. And because of the stress of the whole thing, I was diagnosed. I thought I had vertigo, but we did a lot of testing and I was referred to a neurologist, and I have something called persistent postural perceptive dizziness, which mirrors a lot of vertigo, but it's actually a physical condition. It's a vestibular disorder that is brought on by stress. And the only cure is cognitive behavioral therapy. I take something to keep me from vomiting, because when I get dizzy, my stomach goes crazy and I feel weird, just weird. And so I take that. But I created Rare and Black to be a collaborative work with all rare disease organizations. Eventually, what I plan on, what I would like to do is provide financial support, educational resources, and things like that for anyone that identifies as Black with a rare disease.
Well, thank you, man. Wow. I don't think I've heard people say multiple rare diseases. I don't think I've ever heard anybody say that they had none. I don't think I've ever met anyone with that many diagnoses. Yeah.
The problem is when you go untreated for such a long time, chronically ill, and it turns into certain things. Like, I didn't get short bowel syndrome until June of 2019. And that was after my second colon resection. So that's a thing. The chronic inflammatory demyelinating polyneuropathy came as a result of me having MRSA and staph infection. So, and I'm still not clear from MRSA. I go once a year, they they stick a thing in my nose to swab me and make sure they want to see if the infection is cleared. And I haven't cleared. And that was in 2009, and it's 2022 now.
Wow. So, okay, we got a lot of stuff to cover. You see, I had to pick up my pen. No, that's good. Like, I've been writing down notes of things I want to make sure we talk about. All right, let's go to Stacey. Introductions, please, ma'am.
Hi, thank you so much for having me today. So at 25, I found out that I was diagnosed with MRKH, which stands for Mayer-Rokitansky-Kuster-Hauser syndrome. And it's a rare syndrome where you're born without a uterus and with an underdeveloped vaginal canal. I am now 28, so I've been 3 years in my journey of just accepting that diagnosis and figuring out next steps in terms of going to a specialist. And there's an option for surgery to create a vaginal canal for you. But I also have a physical disability with my arm. So I've had so many surgeries, and I'm like, I don't know if I want another one. And so I created Wombless and Worthy just because I wanted to change the narrative around the definition of what a woman's body is and what a woman's body is supposed to look like. And just really feeling like I wasn't included in that definition. And so just redefining what that means for me, and also just what the world defines that as, just so then conversations can be more inclusive, because not everyone can have children. Like, not everyone has a period to be able to discuss that in group settings. So yeah, that's a little bit of me.
Well, thank you so much for sharing. I have to say, we had a really, really good conversation at an in-person conference, and just you talking about your experience and your journey, I think is critical to the conversation of having a rare diagnosis and being a person of color. I think like so many of us, we find ourselves on these journeys of advocacy and awareness because of our experiences.
Absolutely.
And so I'm so glad that you're here to share a little bit more about your journey. All right, Miss Gina, welcome.
Hey. So I am Georgene Glass, but I go by Gina. I am the founder and executive director of DreamSickle Kids Foundation, which is the first sickle cell organization here in the state of Nevada. I am the mother of two, with my youngest daughter having sickle cell disease. She was diagnosed at birth. I also have a 12-year-old niece who lives in California who also has sickle cell disease, and they both have two different genotypes of the disease. However, we both inherited the sickle cell trait from my dad, so we passed it on to our children. I have been advocating for sickle cell pretty much since my daughter was born. We moved from California to Nevada in 2016. And after having a couple of unfavorable experiences in the healthcare system, and after being terminated from my job because my daughter kept getting sick, so I would miss work, I decided to go ahead and establish an organization to support not just the patients, but the caregivers, because it was a very, interesting and challenging experience being a caregiver of someone with sickle cell disease, going from working pretty much since I was 18 years old to having to pretty much stop working to take care of my daughter. So I wanted to share what I learned along the way and share resources and provide support to patients and families that were impacted by sickle cell disease. And after finding that Nevada didn't have many resources for people with sickle cell disease, I decided that that would be the focus. And in 2020, just seeing that there wasn't much support and awareness for rare diseases in general, we expanded our support to anyone in Nevada who is affected by any of the 10,000 rare diseases that exist. I started initially just to kind of raise awareness, generate some funding to, donate to larger organizations. And just in my journey, I got the opportunity to help to draft legislation here in the state of Nevada for a sickle cell bill, which passed in 2019. And that same year, I was also elected to the Rare Disease Advisory Council that was established by the governor that same year. That council was pretty much established by a lot of cancer advocates, and because of my work in the sickle cell space and also working with the Office of Minority Health, the state of Nevada contacted me just to invite me to be a part of the board, but also to refer other people that I thought would be a good fit for the board. Of course, I chose to refer people who were in the sickle cell space because I know most of the advocates that were on the council definitely did not look like me. They definitely didn't represent diseases or a disease the same way that it would impact somebody that was Black or African American. So I was able to refer a couple of people, not all of them Black, but people who worked in the sickle cell space, to that council. So it has a very diverse makeup.
Good stuff. Good for you. Good for you. Well, welcome, welcome, welcome. One thing that all three of you touched on in your introductions is experiences with the healthcare system. And so that leads me to my very first talking point. We're going to talk a little bit about medical gaslighting. Something that we all have experienced, we all have talked about in some shape or form. Have you experienced medical gaslighting, and do you think your race had something to do with it? Now, let me just start with my own story with Elijah. I think, I've been very, very clear and upfront about our experience and, and being dismissed. And initially, I think we thought it was just all because of the diagnosis. And I know this is something Dionne and I have talked about. Like I not one time did I think race played a factor in the treatment that we were given until, number one, someone asked us in an interview, off the record, do you think being Black has something to do with it? So it made me think about it. And then number two, someone connected me with another family, a white family, who delivered at the same institution that I did, who had a completely different experience than I did. And so that's when I began to really question and wonder, did our race add to the care that we receive on top of our diagnosis? And so I'm curious with you all. And Dionne, I want to start with you because you were 45 before you got your rare diagnosis. Had you had symptoms and they were dismissed, and do you think your race played a factor in being dismissed when you presented with symptoms and concerns?
Let me go back to my last diagnosis. I think I gave you 8. The 9th one was actually, it was just last year. I don't want to say what led up to the diagnosis because I don't have permission from that person to speak. Mm-hmm. But I didn't get diagnosed with Ehlers-Danlos until last year. However, I was keynoting virtually, right? Mm-hmm. There was someone in the comments or in the chat that says, I think Dionne has Ehlers-Danlos. Now, I know people who advocate heavily for Ehlers-Danlos. None of them are Black. All of them are white, right? But what they had didn't affect me. Like, I knew that it was cool that I moved my kneecaps, which as a little kid, I used to move my kneecaps, and I still can, back and forth. I just thought it was cool, right? The very first recollection I can think of was I was 4 years old in St. Louis, Missouri. St. Louis is very segregated, but there was one hospital that I knew of. I don't know if Cardinal Glennon was around then, but one hospital that my mom used to always take me to. I have forever and still right now have chronic sinusitis. I used to get sinus infections every month, or it was either that or strep. And so there was a doctor, his name was Dr. Cherry. I'll never forget it. He used to put me on his back and I would play with his ponytail. And we would go off to the room where they would triage you back in the 70s. I'm 53. So this was back in the 70s. And that was the first, like they would ask my mom, the nurses, are you sure are you giving her medicine? I went into adolescence with hidradenitis suppurativa. Hidradenitis suppurativa is a autoimmune disorder that affects the skin. It's like boils, kind of like, that are not your traditional boils. It's an autoimmune thing, right? So in high school, my mom took me to the hospital because I had one on my behind and I had to have it lanced. Mm-hmm. Well, they were like, well, are you sure that she's bathing? In the emergency room. So fast forward, I've been in the hospital. I'm going to show you this I just happened to have this because I wasn't working in my office today. These are some medical records from one hospital stay. I have them organized by pathology lab. I'm crazy. I'll go and get all of my medical records, the pathology reports. I want to read them. I want to see them because in my medical report, I'm non-compliant. But I'm going to say something that is controversial. People are going to say, I don't think all of the time I was medical gaslighted by Black doctors. For a long time, I had all of my care providers were Black. Every last one of them, OBGYN, primary cardiologist, the whole nine. I had a cardiologist. I was in the hospital for 2 weeks. And she said to me, we couldn't really figure out what was wrong. I think, have you seen a therapist? I had a nursing staff after I had my daughter on the 4th or 5th day that I was in the hospital. I went up to them. I said, can you all shine that light in my eye because I can't see? And my vision started to leave the day that I had her. My family thought it was the excitement of having the baby. Well, when I went up to the nurses station, all of the nurses were Black, all of them. One was facing me, and I said, I can't see. And she said, okay. And they all turned around and looked at me, and I started to cry, like hyperventilate cry. I went in my room and I called my doctor and I said, there's something wrong with my vision and I can't see. I don't know what's going on. He was like, oh yeah, they just hung up. Cause I called him on his cell. He said, they just hung up from me and said that you needed some Versed, which is a sedative. You need Versed, and until they can get you a psych consult. They wanted me to get a psych consult because they think that you're having postpartum psychosis. So yes, race is a thing, but more than anything, being a woman is a thing. A Black thing, because a lot of times that whole strong Black woman trope, like we back carrying, I was getting cursed, Lord, putting stuff on my back. You know my mouth. I'm trying to get better. I'm not gonna do that on your podcast. I don't mind. They think that we can bear everything. Like year before last, I had to get my teeth pulled because of the infections and stuff. So I had to get all of my teeth at the top pulled. None of them were loose. None. When I went into, my condition is too fragile for them to put me to sleep. And so I was awake with anesthesia, right? But he was pulling teeth that were not loose, right? And I'm feeling this. And when they pull, so when you have a lot of infections, your teeth crumble. That's what was happening. My teeth started to crumble in the back, and he was like, let's just get rid of all of them. Now, they weren't loose, but they crumble when you pull. So you're pulling teeth that are crumbling, and you still got to get up here because the roots have to come out. I promise you, when he got to right here, because he went from this side to this, when he got right here, he stopped. He said, you're making too much noise. Now, listen, that's not even this has never happened to me before. I started to shake like this. I didn't even know what was going on. I'm like, oh my God, why am I shaking? Mom, they had to stop. The thing that they have to hold your mouth, I was like that, hitting it. And I was like, I was crying. I'm like, what's wrong? He said, that's your body. So your body's response, your nervous system, when you're in pain, your body goes into shock, which was happening to me because I was feeling him pulling my teeth. My body was having a visceral reaction. And he stopped and said, and he was white. He stopped and said, I'm just going to let you finish because you're not in pain. I don't know what this is. And I was like, okay.
You know, okay, see, and you point out, okay, you point out a bunch of things, but two for sure, and I want to get Gina and Stacey in on this too about the medical gaslighting. But two things that you said. Number one, as a Black person, as a person of color, being medically gaslit by a Black physician. And that's something we don't talk enough about because it happens. And let me just say, I used to work for a Black physician who would only see patients with Medicaid on certain days of the week during certain time frames because he did not want them in the clinic when his private payer patients were in the clinic. Yeah, I worked for him 30 days and I was out of there. Yeah. So it happens. For sure. And I'm glad that you brought that up. Number two, talking about the tolerance for pain. A doctor colleague of mine said that there was a report, a survey done among doctors and physicians and practitioners, whatever, and they all thought Black women had a higher tolerance for pain. And it was on a survey, like 85%. Whatever the number was, that stat may be incorrect. Don't come for me if the stat is wrong. I'm just saying it was a high number that said Black people, Black women specifically, had a high tolerance for pain. So you pointed both of those out. We may circle back. I want to hear Gina and Stacey. Stacey, let me start with you about medical gaslighting. That's a conversation we've had a little bit about. I would love for you to chime in on your experience with it.
Yeah, honestly, like just with going to the conference and learning about that term was like the first time that I was able to apply a term to what I experienced. For me, so at 18, I had an ultrasound, and the lady was like, "Oh, well, you look like she said, I don't see a uterus." But then she's like, "Well, I think you're backed up, so that's why I don't see it." Which, after taking I was a bio major in undergrad, I'm like, anatomically, that makes no sense. And then they put me on medication to try to induce a period, and I was kind of sent on my way. And I'm terrible on medication, so I figured it's just not working because it's something that I didn't do. So by the time I was 25 and went to see a doctor again, who was an older white gentleman, he was just like, when he was telling me the results of the MRI and the ultrasound, he was kind of like, "Well, you already knew that you didn't have a uterus." And I'm like, "No, I didn't, because if I knew, I wouldn't be paying a bill to come see you right now."
Right.
So what are we talking about? Like, if I knew, we would be having a conversation. So he was just very inconsiderate in his delivery of my diagnosis. Had no bedside manner at all. And also he immediately pushed me to surgery. Like, he was like, "There's a surgery that is similar to a gender reassignment surgery that you can have. If you want to do that, give me a call." And he hung up. He also didn't even officially diagnose me. Like, I had a friend, I was in my group chat with my friends, and I had a friend she works in healthcare, and she's like, "Oh, I think I heard of that before. It's called MRKH." So I still had to go to another doctor after seeing him to then officially be diagnosed with that, because I wanted to have it on record and on paper. And I definitely think a lot of it had to do with race, because there was just no consideration of me as a person. And I think if I was a white woman, that my experience could have possibly been different. I know that there are other white women who have experienced similar things just within the MRKH community, but I definitely feel just he was so crass. He was so I was in grad school at the time in Northwestern, and his office was literally a floor over where my classes were. And he just called me in the middle of class. I had to go walk away, take this phone call. And I'm like, "We're in the same building. You know I'm in the same building because I told you I'm in the same building." Like, I scheduled my appointments in between my class breaks. It would have been nothing for you to say, "Hey, are you available to come up here real quick and sit down with me and have a conversation about your results?" And at that point, I would have been able to tell you yes or no.
Exactly. And bedside manner, I think we know, is something they don't teach. You know what I mean?
No.
Like they don't they teach this whole healthcare stuff, the medicine, the science, but they don't teach delivery and how to talk to patients. Because when we got Elijah's diagnosis, I was partially naked on the table when the maternal fetal medicine doctor stopped the ultrasound to give us Elijah's to confirm what was being speculated. So he confirmed the diagnosis, and I'm still naked from the bottom down. And he's giving me so much information, and he's, I mean, very descriptive. I'm just similar to what you're talking about, Stacey, just very matter of fact. And it's one thing to give you the facts, and it's something else to be a jerk. You know what I mean?
Yeah, absolutely.
And the way that he was delivering this information to me, you know, he described this monster. Like, I literally visualized that this baby inside of me looked like a monster, like that you see on a movie. Like, that's all that I saw
Wow.
based on what he was saying to me. My husband had to say, hey, you know, can you give her a second? Like the ugly cry, I was there. That hyperventilation cry, that's exactly where I was. And I just remember I could not get myself together. And my husband had to tell him to stop talking. Like, you need to give her a second, let her process what you're saying, at least a little bit of what you're saying. You're going from head to toe, you know, esophagus offline, stomach is outside of the cavity, you know, bilateral cleft lip and palate. Like, you're calling low set ears, and heart is messed up. You're calling all these things, and you're not
Wow.
even giving her a
Yeah.
second. So that bedside manner is so critical. It doesn't remove the reality of these diagnoses and the conversation. It just helps them go so much smoother if you just have a little tact when
Yeah.
you're talking to patients. So I mean, I think you're spot on in how that delivery. Gina, I want to hear from you. I know I have a lot of colleagues in the sickle cell community, and I've heard a lot of people talk about, especially adult sickle cell patients, and their challenges with, you know, presenting in a pain crisis, especially in the ER setting, looking like drug seekers. So I would love to hear your perspective on medical gaslighting too.
So actually I haven't had too much experience with that as it pertains to Gia. I mean, it's just the reality. When you are a kid with health conditions, they kind of roll out the red carpet for you. Like, if you a kid and you in pain and crying, like, everybody wants to do whatever they can to make this baby stop, you know, not have pain and things like that. But for me, I can remember personally, probably when I was about 25, I went to the doctor because I had this knot on my arm, and I still got it. And I'm finally going, but 14 years later, next week, I'm going to the doctor and be like, hey, I don't think this is what the first one said it was. So I went to the doctor and I was like, hey, I got this little knot under my arm, and like, I don't know why I have it. And he's like, he just touched it and was like, oh, it's a fat pocket. Now, I'm fat now, but at 25, I was not big. Like, I was still 150, 60, 70 pounds. So
Wait a
I'm like,
minute. I Wait a minute. I almost turned my camera off now. Let me just tell you, Dionne, know when when it get good like that, I hang up. Like, if we on the phone and you say something like that, I'm gonna hang up on you. Like, we on a recording right now. I literally almost shut this laptop down. Are you serious? A fat pocket?
like a fat ball. He was like, it's just a ball of fat that accumulated under your arm.
Girl, the audacity.
I'm like, and so I'm like, well, Matt, well, I mean, you know, when you be younger and you think you fat, but you're not really fat, now you fat, and you're like, dang, I wish I was fat like 15 years ago, right? So I'm like, well, maybe. And so I just walked around with it, and then maybe a couple years later, like, my dad had breast cancer, he got a mastectomy or whatever, and then two of my sisters had breast cancer, so I started thinking about it more, like, maybe I should go get another check on this little knot on my arm. I mean, it doesn't hurt, but it does kind of feel like it grew a little bit, and I'm like, I have a little bit as well, but it's time to get it checked out, because he just was like, oh, that's just a fat pocket. I'm like, I go to the gym, I don't really eat junk. Like, how do I got like a ball of fat under like under my arm. So literally I'm going next week so I can address this. So I'll let you know how that experience goes. I'm not gonna just take, oh, you just fat. No, you better go in there and see what this knotty is on my arm.
Right.
But as far as like with Gia, when I was pregnant with her, like they did the testing and they told me that she might have sickle cell, and they sent me to the geneticist, and she's breaking down like the possibility of her having sickle cell and such like that, doing the Punnett square and things, and telling me, you know, what people with sickle cell typically experience as far as their health and things like that. So at the end, I'm like 6 months pregnant. So when she gets done with this, and she like, so yeah, you got about 2 weeks if you want to have an abortion. You can terminate, but you only have about 2 weeks to make your decision. So I'm looking like, what do you mean? I'm like, I've read a little bit about sickle cell. I know it's something that's, you know, it's painful. It is a disease. I was like, but nothing I've read and nothing you've said to me in this 20-30 minutes leads me to believe that my best option is to terminate my child. And I'm not a month or 4 weeks pregnant. I'm literally, I can feel my baby kick. I done start trying to come up with names, and you like, that was just the next thing out of her mouth. Not like there are alternatives, you know, there are some therapies that are out there that might help. None of that. It was just like, oh yeah, your baby could probably have sickle cell. They typically have a lot of pain. They go to the hospital a lot. They don't live long lives. So if you want to terminate, then you have to make your decision in the next 2 weeks. And I'm like, you just told me it's a 25% chance that my child would have sickle cell disease. I was like, so let me ask you, if somebody told you you had a 25% chance of not winning the lottery and a 75% chance of winning the lottery, are you not going to play because of the 25% chance that you're going to lose? Like, those odds do not make me want to terminate my child. I was like, do you see my stomach? Like, how do they terminate somebody's baby that's like a whole baby that could be born like at 6 months? She's like, well, you know, those are the options. You know, most people aren't really comfortable bringing, you know, children in the world that are going to have, you know, a lot of health conditions. I was like, that's so insensitive. And it's actually a theme in the sickle cell community. Like, most people who, I just have the trait, so I'm a carrier. So most people who have the trait, they get that same talk like, oh, you can have an abortion because your baby might have sickle cell. You don't want to have a baby with sickle cell.
Let me just tell you, I could not have planned the three of you any more strategically. Like, I promise I did not know the depths of y'all stories, but it's so crazy how relatable the three of your stories are to mine. I mean, and we're talking about the experiences, right? Like, it's crazy to me that you would be that far along and they would offer that to you. But in the same regard, it's not, because they did the same thing to us. You know, I mean, they offered us they gave us our options when they gave us Elijah's diagnosis. At the time, we were about 4.5, 5 months pregnant. And I think they got so aggravated. I can remember one of the doctors, I'm looking for something to grab to just show you the intensity. The nurse practitioner at the time, she said, but it's 95%. Like, that's how she shook the paper that she was about to give us to read through. That's the force and the authority and the aggravation she had trying to get us to see that our diagnosis, like, is 95%. Like, why would you want to continue on this journey? Well, because I want to, and that should be enough. You know, because I want to, and that should be enough. I want to transition
other people who have children who are, say, have a worse prognosis than, say, a child being born with sickle cell. People of other races are praised for still going through with these pregnancies and having these children that, you know, basically are going to need 24/7 hands-on, you know, care and support, and their quality of life is not going to be, you know, as well as a baby that's born normally, or even a baby that's born with some other minor disability or disorder. They're praised for that, but they tell us Black people, if one little thing is wrong, oh, you should just have an abortion.
Dionne, you look like you saying something. Unmute. You look like you look like you saying something.
I was talking, because I said they don't value Black life. But let me say this: I am a person that does not believe in complaining without a solution. So I came up with a wonderful package. My for-profit company, Authority Strategies, Authority is Swahili for impact. I created this whole work. One of the things was, "Hello, doctor, are you listening?" Remember the book for Judy? Is that Judy Blume? "Hello, Margaret, it's me." Or, "Hello, God, are you there, God? It's me, Margaret." I'm sorry, never mind, because y'all looking at me like that's my age.
Wait, I'm familiar with Judy Blume books, but I can't say I know that one.
"Are you there, God? It's me, Margaret." I wrote because it was one of my favorite books, and so I wrote some framework, and the objective of that is for doctors to listen. So I feel like we should catch them in medical school. And you know, 4 medical doctors that work in medical schools told me they don't have time to teach that because the curriculum is so rigid in medical school. They don't have time to fit you in. You should try to get there the first week of school, and you know how they do the medical schools. It's like rush week. They do this, they do that, they do this. And I was like, no, this needs to be an ongoing thing, because you need, not only do you need to learn how to talk to Black people, you need to talk to patients, period.
Right, that's right.
All with you all. And then I had one doctor tell me the only way that they're going to pay attention to you is if you go to a board like the American Medical Association or the National Medical Association or the Association of Cardiologists or things like that, where they can get CEU credits. I'm like, but this is just listening. I had when my daughter, Lord, I'm not going, when my daughter got diagnosed, because y'all know my daughter, whatever. The neurologist, when they were doing the nerve conduction test, he came in, and my daughter has wanted to, she's been my caretaker. Even when she was like 6 years old, she was packing my stomach because she loves to do it. She wants to be a doctor. This was the day, the Monday after her prom. You know, she had the long nails, so the nurses were in there one on over her. So we're kikiing, you know, having a good time. The doctor walks in, all the air in the room left out. That's how you know when a doctor is an asshole. When seriously, when all the air comes out of the room and they feel like they can't be themselves, that's a problem with the physician. He comes in. He says, "Oh, what are you all laughing about?" And my daughter said it was my prom. And we were looking, I was showing them prom pictures. He comes in the room and he says, after he said that, he said, "Oh, are you a senior?" And she said, "Yes." And he asked her, what did she want to be? And she said, "I want to be a surgeon." He asked her where she was going to school, and she told him. He said, "You know, you should stay off of drugs. If you want to go to medical school, you don't need to be on drugs." Now, there is nothing in my daughter's chart that says that she's on any narcotic. I can't even get her to take a stool softener. She does not like medicine at all. I'm serious. Like even vitamins. She was like, "I'm not taking that stuff." So, and then I said, "What did you say?" And then after he interrogated me, like, "Mom, you have CIDP and primary immune deficiency. What are you taking for it?" And I told him, and I was like, "Why are you asking me?" And he was like, "Well, you know, I don't listen." Now, keep that in mind. He told me he doesn't listen. That was last year. A couple of months ago, I was talking to some physicians that work with him in a different department. in complex care. And I mentioned what he said, and they were like, oh, he says stuff like that all the time. So you are in clinic, you are in cahoots, basically, with people. You're playing with people's lives.
Right.
Like, what is wrong with you?
Mm-hmm.
And then I know his boss. So I made a phone call. I said, you have a neurologist in your department that told my daughter this. And she was like, oh, really? Did he say that? If y'all don't get some sensitivity training, do you know how many years I sat on the phone, customer service? They would tell you when you go through customer service training, put a mirror on your computer so you can smile. You all can say whatever you want to say to people, and these are people's lives. When I've had to sit in customer service training just to give people a credit on a bill,
Right? Exactly.
For customer service, how you talk to, watch your tone. Do y'all not teach any of this in medical school? Like, who raised you? Who raised you?
Now that's it.
Come on, Stacey. I'm sorry.
No, because I'm so big on this. So I work in prosthetics and orthotics, and like cultural competency it's gone. It's not there. And I don't know if it's because
never really was.
And it never really was in the first place. And even though, like, I know with my program specifically, more women are starting to go into the program, but the people who are in charge, who have been there, are predominantly white men. And like
with business degrees, Stacey, with business degrees, because these are not clinicians. They're MBA people or business.
Yes, who know how to run a business, who know how to do the numbers. And they have been taught that it doesn't matter, that bedside doesn't matter, that you could talk to anybody any kind of way, that you can disrespect your patients as well as your employees. And like there's no accountability at all.
And you know, and not to cut you off, I think that's the aggravating piece, that the way that they bring it to you, and I'm just going to speak as a Black woman specifically, the way that they bring it to you, you're supposed, in air quotes, to just take it. The moment you respond in a way that looks aggressive or angry or whatever the case may be, now you problematic. And I think for me, I'm in a place to what, because we all know to be respectful. We all know, you know what I mean? We know how to have conversations and all that type of stuff. But the reality of it is, there comes a time when you have to respectfully let somebody know that they crossing the line. You know, you have to remind people that we're not about to do this. Come on, Dionne, because
wait. I know you. I love you because you are you.
Yeah,
and I'm foolish, and I to health. I am foolish because I got a 45 or 53-year history of. I had, when I got diagnosed with small bowel syndrome, the gastroenterologist that I had, he was not the one that did the surgery, but he was the one that I had, was like, you know, for a while at post-op, I was having a hard time holding down food. And he was like, let's do this, let's do that. And I said to him, I keep coming in here every 2 weeks and nothing is changing. What do you feel? Are you okay with me getting a second opinion? Because he was like, I have patients with small bowel syndrome, but not at this stage in their life. They were either born or they've had a transplant. So I go to the chief of gastroenterology at the hospital that all of my providers are, and he was rude. But my appointment was at 4:10 in the afternoon, so I'm like, I'm gonna give him the benefit of the doubt because we all have bad days, right? He prescribes some medicine. I get it filled. It begins to work. He gave me 2 prescriptions. I am not one to take medicine that doesn't work. What I found is one medicine worked, one did not. So I go back. They kept rescheduling my appointment. I go back. When I walked in, he was there with a fellow and a resident. He asked me, is it okay for them to come in? Sure. He looks down and says, you haven't been getting the medicine that I prescribed to you. Are you going to do what I say? Who are you talking to? He said, you haven't got, because they get record when you get your prescriptions filled. So right. But man, I'm gonna need you to stop talking to me, like for real. So you're not gonna do what I say. You're non-compliant. I said, man, hold on. Let me tell you something. And so the residents and the fellow was like, oh shit, here she go. Like, for real. I said, let me tell you something. What you not gonna do, you're not gonna talk to me any kind of damn way. And I gotta pay you. I gotta pay you a copay, and you gonna submit to the billing. But sir, you're not gonna talk to me any kind of way. Now I don't know what your problem is, but you're not gonna talk to me. You're not gonna get better if you don't do what I tell you to do. I said, let's go. He was like, are you getting infusions? You need to see dietary. Have you been in nutrition services? I said, man, let's get the hell out of here. So we walked out, and he starts cursing at his medical person that makes the appointments, right? It's a whole big group of gastroenterologists, but he has his own person because he's the chief.
Right.
He started yelling at her. She was like, oh, Miss Stalling, I'm sorry. Let me schedule this. I had on a mask. I said, let me tell you something. I took my mask down. I said, look at my face real good. Look, you're not going to ever see me in this again. You ain't got to do nothing, because I ain't never coming back here ever in my life. You don't have to schedule me for nothing. As a matter of fact, I'm going to bring you a cupcake because I got to come back to the hospital Friday because I got an appointment at neurology. You're not going to talk to me any kind of way.
Yeah.
And he's allowed to do that.
Right. And I agree with you 100%. I mean, I think, again, we say the same stuff, you and I. Sometimes our delivery just might be a little different. I totally get where you're coming from, because I agree. You're not gonna talk to me like that. Like, I totally 100% get what you're saying. For me, I think, because I'm not the patient, a lot of the times, I'm speaking up for Elijah. Like Gina was saying, they rolled the red carpet out for kids. Well, they didn't for mine. They told me, take him home, enjoy my time. He was going to die soon. We spent 7 months in hospice care. They were not trying to do anything for him. And one of the way that we connected to the medical team that we have is, he had a procedure done. He started having trouble breathing. We spent 5 days in the hospital. And the hospitalist who came on staff, our 4th day, she said, why are you here? And I said, well, what do you mean? And she said, for this procedure, we don't even have a team who can follow up with you. Like, why did they send you here for this? And I told her, I was like, well, I don't know. I mean, this is where the surgeon told us to come. Like, our kid at the time was maybe 9.5 months old, and we were just now seeing specialists for him. And so we had a ton of questions too. We were excited to just have a doctor willing to see us. And she said, I think you need to be at a different hospital that specializes in pediatrics. Well, I thought you all had a pediatric division. And she was like, not like what you need. So she called another hospital that was 2 hours away, and they said, yes, we want this baby. They airlifted Elijah. We had to drive in the car. And just like you were just saying, Dionne, when we got there, I actually had some family go to the hospital because we had to drive the 2 hours. And of course, they were like 10, 15 minutes away. When we got there, the very first doctor that we saw, she came in and her little quiet voice, she said, we may need to start the conversation of transition. You know, he could be at the end. And my husband was downstairs with my brother, and my sister was in the room with me. And I'm listening to the doctor, and she says, she says whatever she says. And I said, well, that's not why we're here. And she says, well, I know it's a difficult time. And she wanted to bring in like palliative care and get us reconnected with hospice. And I was like, well, but if I felt like that's why we were here, but that's not why we're here. And see, and this is my point about we should not have to. We do, but we shouldn't have to reach a place of aggravation in order for you to hear me, because it wasn't until I said, listen, my sister said, like you said, the nurses, my sister said, uh-oh, and stepped back. And I told her, the doctor, I said, we are not here because my baby is about to die. I don't care who you need to tell. I don't care where you need to document it, but I don't want anybody coming in here trying to talk to me about bereavement services or hospice services. I need whoever can come in here and assess my child, and let's figure out what's going on. We knew to some degree what it was. We just needed somebody to help us figure out what the next steps was. And she said, well, there is no will. Like, this is it. But I think that's my point when I'm saying we try to be respectful. Like, I shouldn't have to get aggravated. I shouldn't have to raise my voice. I shouldn't have to develop an attitude. Like, you should hear me when I'm in my calm state. But I agree.
I would be dead if I didn't. I have pulmonary embolism. And that created me to be on blood thinners. When in 2008, when I got my hysterectomy, I laid in bed all day Wednesday, Thursday. Every time I moved, I vomited. And they kept saying, oh, you have gas. And I was like, does gas make you throw up? I'm like, Friday morning, I moved, it was blood everywhere. So I'm thinking that my IV, like I was hemorrhaging, right? But until I had to curse people out, which is not that is not my thing. I've always been a good patient. But that day I was like, something is wrong. I felt hot. I don't get fevers. People with primary immune deficiency, a lot of us don't get temperatures. Until I started cursing people out, that's when they called my doctor and said, let's do a CAT scan. I was hemorrhaging. I almost died. When they opened me up, they said I only had 2 pints of blood left in me. I had bled for 2 solid days. I had to curse people out to even listen to me. I'm like, this is not gas. I'm about to die. I have 2 children. I have been a single mother for 30 years. You are not listening to me. Right. And I shouldn't have to start cursing people out to the point where other people are coming in the room like, oh my God, what's going on? Because people used to come in my room to chill because I'm the chill patient.
Right.
It's wrong. It's wrong. Right. It's the same. And then you want to say, oh, she's angry. You damn right I'm angry.
Right.
I'm not angry. I'm mad.
I'm mad now. That's right. Jenny, you look like you was about to say something too.
I was gonna say, it seems like in the rare disease space in general, when it comes to healthcare providers, they kind of feel like they can treat us any old kind of way because we don't have a lot of options. Like, oh, we can't just run. Like, when we don't like something, we can't go find 3 or 4 or 5 more, doctors that's gonna be able to treat our rare conditions or our children with rare disease. Like, especially in like the sickle cell community, there's been a few controversial things that have occurred with doctors and such. And literally there's been, you know, people that you would look to that are like, you know, organizational leaders who are aware of this information, and they'll literally be like, well, this is the only doctor that focuses and does this work in the sickle cell community. We don't have a lot to choose from. And you know, sometimes patients do this. And it's like, wait a minute, you're supposed to be advocating for the patients. Like they didn't, you know, they weren't, you know, undercover about it. They put it in print. Like, if you can read English, you see what they said about this community that they're supposed to be treating, this community whose lives they, like she said, they have your life in their hands. And we're just like, we're either really happy that people are paying attention to our rare disease and like physicians and things like that, or we're just going to accept this subpar treatment. I, you know, as a nonprofit leader, you know, I talk to people who are like, you know, I'm being like, I hate how I'm being treated. Like, they do this, they do that, but where am I going to go? Who am I going to go to? Like, I don't have nowhere else to go. I can't drive. Everybody can't drive 2-3 hours away for another specialist. So that they just have to take that and leave. The doctors know this, the specialists know this. So they're like, okay, if I don't treat you, nobody gonna treat you. Or what I'm gonna do is, I had a client who contacted me because she had to get some surgeries, and she only had her hematologist. She didn't have a primary care physician. So her hematologist basically was clearing her to get these surgeries, but she just so happened to finally get a general physician who ran like the test to check her heart, to check her kidneys, to check this and that. And she found that she had something going on with her kidneys and something with her heart. And she's like, you can't get this right now. We got to figure out what's going on with your heart and such like this. But she had already had the first surgery done like a year or so ago, because the hematologist was like, okay, your numbers look good and we signing off, we clearing you for surgery. So something could have happened to her then, but thankfully she had a PCP who did the additional test, because she's like, how could, you know, of course, you know, a hematologist is a doctor and they can do a lot, but that's not their specialty. You know, the heart, the lungs, and things like the kidneys, that's not their thing. They're, you know, for the blood and things like that. So how are you as a hematologist clearing, you know, this patient for surgery when there's other things to consider? And she just was getting, you know, subpar treatment. So it was a big, you know, like network that had other hematologists, oncologists that she could have went to. Once she, you know, made it plain to that her doctor that she wanted to go to another hematologist in that network, he refused to sign off. Why would you refuse to allow her to go to another doctor in the network? She clearly, you guys are not, you know, gelling. Why can't she go to another doctor in the network? It's probably ego. He didn't want to have a patient on the books that didn't want him no more, so he wouldn't just sign off. So you would rather this person needs this specialized medical care to not get the treatment that they need to help them manage their quality of life, because you don't want to be that doctor who patient didn't like them and chose to go somewhere else.
Right. So now that's a good segue into being a patient organization leader, you know, and the challenges that come with that. As a Black woman, all four of us have leadership experience. We have founded organizations and patient organizations for whatever reason we did. It really because we felt that something was missing in the space, which is why we did it. But let's talk a little bit about being Black women in this space as patient organization leaders. Like, what has your experience been in terms of building relationships and collaborations, partnerships, networking, getting funding? Like, what have you experienced? Gina, let me start with you.
I'll say for me, it's been when I started the organization, I had just got fired. So pretty much it was, you know, my savings, my unemployment, and my family who helped me to fund most of the things that we did for the first year and a half, almost 2 years as an organization. And then, you know, networking, putting myself out there, eventually led to some, you know, sponsorships and things like that. But just in the sickle cell space in general, it's very underfunded, undersupported, and as are most, if you do a little research, most minority-led, Black-led, let's just be clear, Black-led organizations are, you know, grossly underfunded, undersupported, and not just by, you would like to think it's just by the other people, but by our people as well. I can say, like, I live in Nevada. I can say that in the 5 years that we've existed in Nevada, majority of any support we receive comes from outside Nevada. We've probably gotten like direct support, financial support from the state of Nevada, maybe equal to about $10,000 in 5 years. And we've done a lot for the state of Nevada when it comes to sickle cell. The organizations that are, or the community that's Black, that's the organizational leaders, they don't support us here. They don't support us at all. I can say that, so I also assist other people with, you know, establishing their organization, sustaining their organizations, help them with strategy and things like that. So I've mentored a couple of people here to starting their organizations. One in particular, a partner I mentor, it's a male. Their organization was more the entire gamut of social, food, housing, and everything like that. I know that it came to a point where there would be times we would go to networking events together, and we'd be in conversations where one time we were in a conversation with this man, and he literally, he would be asking things that was about sickle cell, but would direct it towards this man who clearly had told him she runs, you know, she established sickle cell in the state of Nevada. Or when I would respond, he literally would ignore me, wouldn't acknowledge anything that I said. And there's been times we've been places where people, white, Black, whatever, would talk to the guy about sickle cell, which he never pretended to know, be some expert on sickle cell, and I would literally be standing right next to him, and they would rather talk to him about it than talk to me. His organization even being more newer, doing great work, but everybody wanted to support that and had nothing for sickle cell. And then you have these people who are out here, Black this, Black unity, Black this, Black support this, Black support that, Black large organizations. And I'm like, okay, you're a Black organization, a national, global, whatever, Black organization, and you have, you know, events, you raise awareness for breast cancer, diabetes, you raise awareness for traffic safety, crossing the street, you address social justice, you address hard stuff, but how are you for Black people when the most common genetic disorder that primarily affects Black people, y'all never speak on? Like, and I call people out about that all the time. I have no problem. Like, you cannot convince me that you really support Black people when, you know, sickle cell, sarcoidosis, things like that affects primarily, you know, African Americans, and y'all be crickets. Y'all don't have nothing to say. So those are the kind of things that I deal with as a woman, where a man is gonna get more respect, more support. I've even had where they will be all about DreamSickle until they, you know, see other men doing stuff, and the women, they just be like, bye, home girl, we finna go over there, we ain't worried about what you got going on. And it's like, what's the reason?
So are the men running sickle cell organizations too, or are they just flocking to them?
No, they just, because they're men and they have more respect for a man that's running a nonprofit organization than for a woman, a Black woman that's running a nonprofit organization. Another thing is, I began this organization here. When I came here, there was really nothing. And like you said, you weren't able to do your research to find out, about whether or not you were one of the only minority Black podcasts. Well, I did my research. I looked for sickle cell organizations in the state of Nevada before I even started one. I looked high and low. There were none. So part of our thing is, because branding is everything, right? So we assert ourselves. We're the first sickle cell organization in the state of Nevada. I've had many people come to me, Black for the most. Oh, we don't like that you say that you the first. Because in 1980, 1979, there was this man who did this for sickle cell. So really, you ain't the first. I said, well, according to the state of Nevada, Secretary of State, we are the first sickle cell organization. We don't like that you say you're first. I've had we don't like your hashtag make sickle cell popular. We don't like that you say that. We don't, there was an organization here, a cancer foundation, and they had a sickle cell program. So it was a little support group. They're located in an area where it's not accessible to the population of people with sickle cell, AKA Black people. They're not gonna really drive 30, 40 minutes for some pizza and an hour of conversation. It just doesn't always make sense for them to do that. So I started participating in this and, coming with ideas. The reason why DreamSickle exists is because it was getting close to Sickle Cell Awareness Month, and we were at a support. I said, hey, are we going to have a walk for, Sickle Cell Awareness Month? The people said, oh, we don't have no money for that, and it's not that many people that'll show up, so y'all can walk in our parking lot. And I said, so you want a sickle cell organization to do a charity walk in a cancer foundation's parking lot? I said, do y'all charity walks in the parking lot? No, we don't have money. Cancer foundations got money.
Right, like
money for a walk.
Right, like you touching on so many things. Like I'm literally sitting over here writing down. It's so funny that you talk about researching other organizations, because let me tell you, I did the same thing. I wanted to look and see what was out there, because who try to compete or reinvent. And we felt like, if something is present, we can support their efforts, and we can support their efforts and tell them what we're thinking, what we felt like was missing, and see if we can help build their organization. We found maybe 3. We didn't hear back from 2. Didn't hear back from 2 of them. And one of them that we did hear back from, they said, we are not trying to cross over into the space that you're trying to do. We give you our blessing. And they actually refer us patients even today. They refer us patients. And so I find it very, very interesting that that you did the same thing. I mean, it shows me that let's be honest, we not in this space because we think it's glamorous. We feel like there's a need for what we're doing. Right. Okay, now Stacey and Dionne, I need y'all's perspectives on this whole being patient leaders and experience with collaboration and how how people treat you as an organization, because I completely feel where Gina coming from. Let me start with you, Stacey. What has your experience been like?
I'm definitely just like beginning with this, and I definitely want to get to a point where Womenless and Worthy does become an organization. Um, and I'm so inspired by you all. But just with my work with Beautiful You, I think the biggest thing for me is representation. And seeing that there is a lack in it, knowing that Black women have MRKH and there is an entire different experience that we have with this. Especially just around, I grew up with my parents saying what happens in this house stays in this house, and how infertility, that has kind of fallen under that umbrella of these are things that we don't talk about. These are things that we don't bring up. Well, that's auntie whoever, and she just like to travel and she just like to have fun. And there's not really necessarily a conversation about those things. And even when I've reached out to different organizations, just when it comes to collaborations or different organizations that might have bigger followings, they'll say things like, I remember someone did like a post during Black History Month. It might have been like 2 years ago. And she's like, how do we, share more Black stories and just kind of diversify our content and our information. And I'm like, well, you have to seek out Black stories and know that they are valuable and honor them and support them.
Or
And
you
her
have to ask,
response,
you have to ask Black people.
right, exactly. You have
Right.
to ask Black people. Like, let's start there. And her response made me so upset because she was like, well, Black women don't talk about it. And I'm like, see, y'all use that as an excuse to not do the work.
How do you know they don't talk about it? If you don't talk, you
Yes,
ask where to find them at, so you clearly not talking to them. So how
Well,
do you know
exactly.
they don't talk about it?
right. And Stacey, I want you to finish, but I gotta say, I completely agree. I have heard researchers and scientists say the exact same thing about clinical research. Kind of like Black people don't want to participate. Well, like, how do you know they don't want to participate? I mean, like, we know that there's a history behind research that creates this hesitation for Black communities. Yes,
Exactly.
but how do you know that that Black people don't want to participate or share their stories? Go ahead, right. Go ahead,
Right.
Stacey.
Right. And just and I'm like, if you look up a hashtag, if you do enough research, you'll find them. And I know that's not true because I know at least 10 who probably know another 3 or 4.
Right.
But just like you're using that as an excuse. And so just definitely making sure that I continue to share my voice and I share my story, and I make sure that I'm in spaces where there aren't people that look like me. Um, and being comfortable with that, being comfortable possibly going into a room and being the only one. And just knowing that I deserve to be there.
Yeah,
But
that's right.
it's I'm like, y'all gotta stop using it as an excuse because that's so old. Y'all gotta find something new.
Yeah. Like, that's like we ain't even there no more.
Exactly.
We not there no more. All right, come on, Dionne. Tell me about your
I know
experience.
she took the mic off. Go ahead.
Right.
I'm I was in a room of probably 5 patients and about 50 or 60 researchers and physicians. And I got the mic and I said, where are you looking for Black people? Because we like Visa, we everywhere you want to be. We're even in Idaho.
Come on.
But we ain't accepted everywhere like Lisa, though.
Not accepted anywhere, but when you tell me that your research is based on you're trying to do something for Black people and you can't find them, where are you looking?
Right. That's right.
Calls, Dionne, can you help us? And I don't mind once you ask, but don't just say you can't find them, because I propose this, and then I'll go to my patient leadership. I feel that NIH and the FDA should not delve out money to anyone, any entity, unless you know how you get your house worked on with the contract and they say don't pay him all up front, just when he do the windows, give him the money for the materials, don't pay for the labor because he ain't gonna come back. When you get these grants for $2 and $3 million and you say that this is for the vast majority, don't forget about Black people. Don't forget about Indigenous and Native Americans. Don't forget about Native Alaskans and Island Pacificers, because we have those in this country, but they're not listed in your thing. And so you say, well, we only had 2% Black people because we couldn't find any. There's a census.gov. And you can type in any zip code, any state, it'll give you the percentages. And then you know what you need to do, in case they're listening. You need to look at the zip code and look at the medical, and I am not a divine nine. I'm not we ain't have enough Black people in my college to even have a Delta or AKA line. But if you want something done, go to the Greeks, because every Greek knows a layperson. Like, I got family, friends, and all of the things. I'm going to move away from that because that's my standpoint.
Okay, now, but let me just chime in real quick. And don't wait till you need us to show up. See, now you gotta make sure those relationships need to be built before you come in there asking for stuff. Right. Because that's what continues the distrust, because you only show up when you need us to respond to something.
Just show up. Come with some money.
Come with something.
Come. We don't need.
And that's what I mean. Yes, I'm agreeing. Yeah, I'm agreeing.
Not no sandwiches.
Right. Look, Chick-fil-A gift card.
We don't want no Amazon gift card.
We need hosting for our websites. We need lighting to do things like this. We need
that PR that y'all pay hundreds of thousands for a year. Y'all can throw a couple PR, sets to us. What are we supposed to do?
And that's the reality of it. If you build relationships with patient organizations like ours, we can help connect you to the people you need for your clinical research. But even
$green, they can do other stuff for us that don't cost $green, and
that's right.
Still great.
That's right. Come on now, Dionne. Come on. I want your perspective, your experience about being a patient organization leader. I need that.
I have had mixed reviews. There are two women that have really become friends of mine. There are two white women here in Missouri. One's in Kansas City. She founded two rare disease organizations, and the other one used to work in the healthcare space. I think she's in cannabis now, but I posted about our event. She posted it on her LinkedIn. As soon as she got the email, I saw when she responded to the email, then it was on there. She's been an ally. I'm going to be just like Gina. And Black people can say what they want to say. I don't, I'm Black. I don't care. Black people have, okay, so there are two types of people in the world, right? That are in the advocate space. There are people that want to do the work, and there are people that want to look like they do the work. And don't shut this computer, Sarita. It'll cut it. And in that, because I look to collaborate with a lot of people, right? I don't care. My focus is to be a bridge, to be able to provide support and education. And if that organization don't have any Black people, or they feel like they don't have any Black people that have that disease, I still want to work with you, because we are underdiagnosed. I know this because I was underdiagnosed, right? The problem for me has been funding. I have sat next to people in spaces, don't look like that made me feel like I'm gonna get this money for you. And then when the decision comes out, I don't have it. Now I've broken bread with you. We kikiing and the whole nine, but I can't get the support. But when you want me to speak at your event, then you'll contact me and then have the audaciousness to say, we don't have money to pay you. Well, you know what? Dionne don't speak for free no more. I don't. There has to be a mutually beneficial. I need to be able to get in front of somebody that I know is working, like Rare and Black is working on an infant mortality, newborn screening, and rare disease initiative. If I can't get money to save these babies, then I can't speak to. And you know what I do? I go to the IRS's website and I look up these nonprofits. If you got gross receipts that's over $2 million, you can pay me $5,000 to show up because I'm offering something, right? Okay. But also, we need support. We can do it on our own, but that goes into the whole strong Black woman thing. Like, we can do everything. We gonna be all things.
Either we don't ask either for that support. I've talked to organizations like pharmaceutical companies and such, and they're like, yeah, they asked us for, one told me I had a organization, a sickle cell organization, and they were scared to ask me for like $300. What?
Well, I'm not
see, y'all got a B behind y'all name. You think I'm gonna ask you for $300? I turned down $500 from a pharmaceutical company. You not finna give me $500, no man.
Well, see, at least the thing about it is, I am not afraid to ask for what I need. The problem is, like the one of the women that I was talking to, I'm here in St. Louis. I do a lot of work, and I'm a Washington University Community Fellows Training alum. I went through the training, valuable, wonderful training. And she said, I kept saying, because this summit that I'm having was supposed to happen last year, but I didn't have the money to pay for the venue that I wanted to have the food, right? She said, just call them. And I said, girl, I called them. They ain't call me back. She was like, I know. I said, you're a white woman. Call them for me.
Exactly.
And she did. She made a phone call. And you know what?
And they did it, huh?
Not the department where I'm having the event, but a different department did call me back and say, she told us that you need something. Can we help you? And I said, I've already been in contact with the people that I am, but thank you for calling me back. But you see how that works? Just like me trying to get data from the state of Missouri. I kept emailing them and calling them, and nobody called me back. A white doctor, I told her my dilemma, and she said, let me make a phone call. I got an email with 3 people on the email thread. So those are the types of things that I have issue with. And I want us, if we are talking about Black philanthropy and this is something I want to say. Let me say this, because I got a lot to say. But anyway, Black people need to stop, Black organizations. I'm gonna say this. If you are a Black organization that are doing umbrella things, let's not glorify celebritydom. I don't want a celebrity that has resources, millionaires, that's living in California, oceanfront, don't have issues with whatever. I don't relate to them. Go and find some patients, because it's millions of us. It's 1 in 10 people live with rare diseases. Go find a commoner. Please get on Twitter, follow a hashtag and say, I'm looking for this. And I guarantee you will find a layperson. We as organizations, because it's none of us, spend hundreds of thousands of dollars for hair, makeup, film, audio, visual to do public service announcements for organizations that don't do shit. The
celebrities don't, like, you can literally tell they only doing it for a check.
That's why I said it's people that's doing the work and people that want to look like they're doing the work. But it seems as though the people that look like they're wanting to do work are getting all the money. Well, and this is something that I will also say, Gina. I had someone to tell me that they would offer me such and such dollars in order for me to give them information about Black patients. What you will never have to worry about with Rare and Black, I will never bastardize Black people's data for an organization that does not show up for us. I would prefer to even just, we can do the bylaws and close it down, but you're not, I can't be bought. Our data can't be bought. Our initiatives can't be bought. Everything that I do with this organization will be done with a patient first model. I don't believe in having patients and caregivers pay to attend events that are specifically for them.
I agree with that. I agree with that wholeheartedly.
Yeah,
And
it
our
does.
trust can be bought as well.
Huh?
What'd you say, Stacey?
Our trust can't be bought as well.
Right.
Exactly. Because I believe that all of our organizations, when you have data that is, when you have information from Black organizations by Black patients, they sometimes trust us more because they consider the source, right? I had a lady ask me yesterday, she was telling me about a Black woman on the East Coast that came up with this booklet. Their organization, and they're a wonderful organization that is women led, but this one woman is an entrepreneur and she created this guide and she's charging for it. And so the white woman, who I consider a friend, asked me, would people pay for it? I said, the people that need it the most can't afford to pay for it. So that's why your organization is, I'm not going to knock the hustle. Like, I've been a serial entrepreneur since I was 5. If you can make a guide and have people spend it, pay for $27 for it. I also told her they're going to buy it because she's a Black woman and it's talking about a Black issue, right? It's about trust. I trust this woman because she's created this. She is an expert with lived experience. That's why I'm going to buy it from her. But you all keep doing what you're doing because there's millions of women that cannot afford that.
Right.
Right.
And
a lot of white-led organizations and agencies and entities, they feel like they can gain the trust of Black people vicariously by using organizations or individuals as props, like, see, you got this Black person, trust us, and things like that. And that's not always, that shouldn't be the case at all. Like, no, you don't.
Or you can throw
free pass. You don't get to come to the cookout because you with me. No, that's not.
And I think too, one thing that I've noticed is when there are several organizations, it's disappointing to see a lot of the Black patients flock to the organizations run by white people. Even if nobody on their team or board looks like them, they will support that white-run organization. And I'm not, this being rare and Black is not anti everybody else. Let me just throw that out there right there. This is not a conversation to bash anybody. We're talking about the lived experiences of being Black women in the rare disease space, being Black patient organization leaders in the rare disease space. That's what we're talking about. This is not
every angle. We get it from.
That's right. It's coming from everywhere. That's right. So let me just
are going to say, oh, you're white, we want your kid to die, or we want you to die. That's not what we do. We create a scene where we felt needed to be run, right? I created this because I just want the visibility of knowing that we at the table. And what I strive to do is hold you accountable, because you can't get federal dollars for certain things and not have Black people, Indian and indigenous people, Native Alaskan people left out of the equation. I am on several engagement boards where I help them craft the language in certain things, and consistently, they'll have the LGBTQIA plus. They will have Black, Hispanic, and white. What about the people that got here first?
Mm-hmm.
You forgot the Native Americans.
Right. And I think Gina even raised a good point, about just the financial support, collaboration opportunities for specifically Black run organizations compared to other minorities. I mean, let's be clear, other minorities get a lot of support as organization, especially advocacy organization leaders, because they are more of an ally to an organization that doesn't have that group of people. So they are a resource. But we still Black organizations.
If we're Black, then it's like, oh, they said that they Black. I was told by a an executive of a hospital foundation when I first started. He told me, because when we first started, we had like these two little kids, because one reminded me of Gia and one reminded me of my brother that passed away. So we had these two little kids like on our little advertisements. He told me, you're gonna have to take those Black kids off. White people like donating money to Black people, but they don't want to see and know that they donated money to Black people. So them little Black kids right there, you're gonna need to take them off if you want to get some real money.
At least
like your logo.
But they were just, how you have different little images on, like it was on my business card and like little different stuff. And I was offended, but in going through what I've been through as a nonprofit leader, low key, he was absolutely right. I was so surprised. Like when I started the organization, I'm naive. I'm like, oh, these like the cancer organizations are going to be so happy because now I'll be able to support the sickle cell people and I'll be able to help them. They iced me out. They sent moles to infiltrate to see what I was doing. Like, just go see what she doing. Sent 2 Black women to me. And once they saw I was cool, they told me like, yeah, they sent us over here to find out what you was doing. Don't tell you nothing. And like, they just shut me out. Like they would talk to me. And I'm like, we didn't even barely have $500 in the bank. We talking about a cancer foundation with millions of dollars. Why would they be pressed by little old me?
Well, at least they tell you to change the name of your organization.
Really?
Why do you have to call it Rare and Black? Is it people of color? It's like, no, because there are red people which are Indian, yellow people are Asian. No, Black people.
And they don't like to hit, so it's easier for them to support organizations that, say persons of color.
Y'all, this is what I don't understand. With Jewish organizations, there is the Jewish community, JCCA is usually in every city, metropolitan city. They have a community centers. They have JDate, which is a Jewish dating. Nobody talks to about Jewish people supporting or having their own. I don't understand. Is it some type of indoctrination that Black people have that white is right, which goes to Sarita's point, where Black people will go to white-led organizations, and that's fine if you're being effective and you're inclusive, right? Yeah. We're talking about we could get farther together. Like, just because you are going to an organization that has millions of dollars as their receipts does not mean that they're impactful. Because you know what else I'm tired in the rare disease space? People keep talking about what is wrong or what we should do. Mm-hmm. Where are you in the hospitals and in the clinical settings trying to improve somebody's life? Mm-hmm. Mm-hmm. Like, we can only get together so many times a year to have panels, to have discussion, but where's the work?
Right.
That's one thing, is like action, like where is the action? Another thing I want to say, I remember somebody told me, a friend or somebody was like, the grant applications and the calls and stuff, they just flow differently from white hands. I'm like, what do you mean? Like, that's why you see that, like, it really does. They really get, like you said, I've had several people, even at one of the meetings that we went to, like one of the first, like, I think Global Genes meetings I went to, and we're having our little round tables and things like that. And these organizations, brand new organizations, like, oh, I just started my organization. I hadn't even finished the process, and this pharmaceutical company gave me $15,000.
Wait, listen. Look, she fell out.
Wow.
Listen. I heard a lady, she said they got started and raised $2 million.
I think you're talking about the same. Is she not in St. Louis, is she?
I don't even know where she is.
That happened to me. The woman
and I'm like, okay, well, you know,
How?
and so here's the thing for me, and we're gonna wrap up because I done held y'all long enough. Everybody, and this lady said this on a panel. So here's my thing. When it comes to relaying information to the people you say you serve, everybody in the room can't fundraise $2 million in 1 year. And if those are the people who are sitting on your panels, then you got the wrong people in the room. If they can't, if the people in the audience can't take that information and utilize it to raise $2 million too, then you talking to the wrong group of people. And I think that's one of my issues. We
talking.
It's what Dionne just said.
You exposing these already successful organizations. Let's talk to the smaller organizations like us about our challenges, about what we're trying to do, our initiatives, things we have done. I'm sure we've all done some great things for the rare disease community, but that's not who they want to talk to on a panel.
Right. But see, and that's the thing. And that go back to what Dionne was saying. You fine with us being in the audience.
Mm-hmm.
And you know what I'm saying? Like you fine with us being in the audience. Yeah, say it again, Gina.
They'll have, when the recap, and have our little black faces on their little advertising.
Like
in the pamphlets, all of it.
Right. Like we good enough to sit in the audience, but if the person on the stage talk about $2 million for their foundation, like how can the little grassroots organization compete with that? You know what I mean? Like how is that helpful to the community that you say you serve? I mean, even when it comes to that collaboration and the partnerships and talking about trying to build relationships with other organizations. I mean, I have had
on these stages and say they want to come into the Black community and do this and do that, and you send these people emails and contact them, and you don't get no response. So you just sat up there and put on a whole show about how you would love to be able to be a part, and your organization support the Black community, the Black women, the Black men, and the kids, and all this other stuff, and you're just trying to figure out how to do it. And so many other diverse organizations here, we would love to connect,
or even after the conference, why don't you send me an email? I'll help you. I did this, Sarita, but I didn't want to shut my computer all the way down. But
crickets. And you like, you just was up there for 30 minutes talking about how you want to expand the diversity and inclusiveness of your organization. And
I just told Sarita, okay, I just got to share this for the people that's listening. Sarita knows this because I told her the other day. I was at a conference a couple of weeks ago. I had on a mask. I don't have it with me, but I had on a mask, right? And I was talking to a white woman, lovely white woman, very ally-ish. We were talking, and this tall white man walks up to me. And I can't say what I want to say because this is the podcast, and I cuss a lot, but the Lord. He said, he never said, excuse me. He never said, hi, my name is Dan, or whatever his name, because I still don't know who this man is. He walks up to me and said, you know, you shouldn't be so abrasive when you. That's what I said. Well, hold on. You shouldn't be so abrasive when you speak. And I said, what? I get Botox for headaches, so I don't know if my frown, because my daughter be always saying, your face show it all. And I was like, what? And he said, you're assertive when you talk. Have you ever heard of the saying you get more flies with honey? And I said, sir, do I know you? Like, what? I have on a mask. The lady that I'm talking to does not. I've been wearing masks for years, so I'm trying to figure out, do I know you? And he said, I heard you on Friday. You were on a call. So it was like 30 or 40 people on this call. There was one Black woman. It was an industry. It wasn't a nonprofit organization. It was industry. I won't say what industry because I'm trying to get some money from them.
I know that's right.
Right.
But he was like, I said, sir, I'm going to need for you to stop talking to me. And he said, I'm just trying to tell, sir, stop talking to me. And I had to get indignant to the point where I'm like, I'm gonna cuss your ass out if you keep talking to me. Like, you're not going to, I don't understand why people feel the need that they can talk to Black women. Because if I had been a Black man, it would have never happened.
Exactly. Exactly.
No, that definitely.
This, and you're comfortable with saying it, but you said it to the wrong person, because I will curse you out and I don't care. And I told him, I said, I don't have anything to lose. You know what I'm waiting on? My daughter to get her white coat and my son and his wife to have some babies. That's what I'm waiting on. I am chronically ill, and what you're talking about. And then he said, but you're talking, I forgot exactly what he said. And I had to think, like, what in the world did I say for this man? And he said, your voice is very distinctive. That's how I know it's you, and your hair. And so I was like, you know what I said on the call of these people? Because a woman asked me to come to the meeting. I didn't seek them out. She sought me out. And she said something about DEI policies and procedures. And what I said, and I'll stand on the top of every mountain, you all don't really want DEI. You want diversity, equity, inclusion on your website, in your promotional material. You want to be able to say that you hired a person for your diversity, equity, inclusion. But when they try to change your culture, you put them in their place, like you think that that's their place because they've been too vocal. Now, keep in mind, I'll say whatever in the hell I had to tell him. I'll say whatever in the hell I want to say. Mm-hmm. Like, and I'm not saying that I'm always right, but my heart is always in the right place. All I want to do is to do right by my people in the rare disease space, because I know what it's like to be a patient. I know what it's like to not have money for wound care. I know what it's like to not have Medicare pay for. So I'm a Medicare recipient. I know what that's like. You know, everything that's going to be at my event, I have lived it, with the exception of genetic counseling and newborn screening. That's not part of my story, but the genetic counseling is, but not newborn screening. But I know people, every story that I take, Rare Disease Week, there's a woman that has faithfully donated to Rare and Black because she heard me, she told me her story because she didn't want to speak during Rare Across America. And I tried to have one-on-ones with the people when I'm a team coordinator, so we can coordinate who's going to say what. And, you know, I want to make sure you say it in a timely fashion. She wasn't comfortable in saying her story, but I spoke for her and she heard me, and she donates through her job. They have a match for match program. She donates out of her paycheck every pay period. That's the only person that I know that I can count on a donation. It might not be sizable, but it means the world to me.
Right.
That's the things that are important. You know, you are having $1 million in receipts, and you want to say, we want to work with Black organizations, but you don't follow up, or you got enough money to hire a liaison, a minority advocacy organization liaison, to work with every minority organization under your umbrella or who you have come in contact with, because you got the money.
They will, but that person don't have no power. They will hire a person who's supposed to be,
you know, I want you to make it make sense, you know, be effective, because I'm not a person, I don't care about who you appointed. I don't care about that. I care about when I hear people saying, I had to leave. You got people out here that can't get married. You know what I'm saying? Because they'll lose their insurance. You cannot live the way that they want to live because of the way that the medical system and the policies that we have in place are not conducive to families. And it's the only I could go on and on and on, but that's my point. You know, we started organizations to do the right thing because we didn't feel like certain voices were heard. And we have to and to be aligned in a place where there are so many organizations, different organizations, like for all kinds of diseases that have money, and people just throw at it. They don't even care if you're doing nothing effective. You having a gala, oh, it's $300. Let me buy a ticket. I'll buy a whole table. It's like, do you even know what these people are doing?
Right.
They throw all the money at organizations that already have money, and those organizations, they too high up, they're not on the ground. They don't have people calling their phone. I'm a executive director, and people call my phone when they need a ride to the hospital and they ain't got enough money for the Uber, or they don't have no ride. They call my phone. I don't have 2 and 3 and 4 staff members, and
about organization
process for the intake. It's like, let me check the bank account. Okay, we got it. Fill out this form, and we gonna get you where you need to go. Oh, you need $100 so you can pay for your prescriptions for this month. Okay, fill this form out, and we gonna check the bank account. Long as we in the green, then we gonna handle that. These other places, they have all this red tape that you have to go through to get support. I had a lady call me. She has 8 kids. One has sickle cell. She's pregnant, and she called one of the big national organizations for help. They told her she had reached her max on assistance because they gave her 4 $5 gas cards in the previous year or for that year. So she reached her max, and she needed food in her fridge. She had lost her place, finally got another place, but CPS was coming. So she needed to get, they want your fridge to have food in it. So she was looking for some food assistance. And they told her, oh, we reached our capacity. They get state, federal grants from here, there, everywhere, all this money. And they thought that $5, what's that? $25, $20 in gas cards was a max to reach for helping families.
Listen, we could literally talk about this. I'm talking about until the wee hours of the morning, because it is so prevalent to, I mean, you see, I'm literally I was full when we started, and I'm like,
Jack Daniels watermelon.
I mean, like it's crazy. Okay, so we wrapping up. Stacey, last words. Being rare and Black. We're gonna wrap up, and I'm gonna probably have to put this in like a 2-part conversation. Yeah. Or, I mean, we covered so much stuff, but that's what Being Rare is all about. We talking about real, uncensored, raw conversation, because that's the only way, to me, for people to truly know what's going on and how people feel about it. Like, I don't want the polished. I want real talk. and y'all gave that, and I appreciate it so much. I done fell out twice and sipped up all my water. All right, Stacey, last words, and I'm gonna let y'all go.
Honestly, like y'all brought up a lot of good points, just in terms of, why people have an issue with us being focused on being rare and being Black. And I think it really comes down to the privilege of never having to be excluded. And that, it's kind of like, well, I'm not a part of this. Like, why can I be a part of this? And it's like, we haven't been a part of this for years. Like, our stories haven't been a part of this. Like, even when you think about concepts around DEI or even organizations, diversity, equity, and inclusion organizations being created, they are derived from people feeling excluded and feeling like they need to create their own group. So, I mean, kudos to y'all. Like, y'all are doing it, and y'all are having these very important conversations and being in these very important spaces.
And you're doing
Yeah.
don't discount, because you are the one that came in behind us. You're doing it too. Your voice matters.
That's right.
Thank you.
That's right. Which
Thank
is why
you.
it was so important to have you be a part of the conversation. We share some really, really great conversations, and one of the things you said, Stacey, was having a voice and nobody allowing you to use it. And
yeah.
And that's a really, really bad space for anybody to feel. And so as Black women, I know Dionne and I talk and text. Gina and I have started sharing conversations. I will talk when we see each other in person, but I think we have to create our own support systems. And again, and it's we're not looking to exclude anybody else, but we know the challenges that come with being a Black woman, period. More or less a Black woman in the rare disease space, a Black woman as a nonprofit leader, the Black woman as a caregiver. Like we know what all those experiences look like. And so we have to draw experience from someone who can relate, because let's just be real, we may experience some of the same challenges with people who don't look like us. But when you add that your skin dark on top of that challenge, now our experience ain't the same no more. So,
it's not the same anymore. And I think just what you mentioned about like being community leaders, being a part of organizations, being a Black woman, that's the intersectionality of it all that has to be accounted for. Like these organizations are supporting Black people. These organizations are supporting people of color. Like you all are, like we are Black women coming into the space and representing not only our rare disease but ourselves and our experiences.
Right.
Yeah.
And
right.
so,
And another thing I was just going to add, I know we're going to wrap up. Burnout is real.
Yeah.
I'm already feeling it.
I'm Sarita, and Gina, I know because Stacey, you work during the day. I don't know if either of you were listening or was watching the HRSA hearings last week, where, HRSA votes on what conditions are going to be on the RUSP list.
No.
They had the hearing last Thursday and Friday. And when I tell you that I cried, I was crying watching it, and I cried after it was over, because you had people of different, more white than not. I mean, it was mostly white, but that's what I'm saying. We don't care. We're not saying we want anything to happen to you, but because newborn screening is so crucial, and I feel every rare disease needs to be on the RUSP list, but that's a whole another thing. But to hear testimony after testimony after testimony, people talking about how they lost their children, siblings talking about how they survived because of the sacrifice of the first child, and to have a body of people vote 7-7, so it was tied, they voted it down for Crab A not to be on the RUSP list. It's like, what are we doing? And when I was in bed by 5 o'clock Thursday, it was still light outside when I got into bed, and I slept until in the morning because I wanted to see the second day. Burnout is real. And I am working with my therapist. I'm trying to find a self-care routine, but I get so wound up. I can't, you're passionate about something and you have to get something done, but we also have to remember not to lose ourselves in our organization.
Right. That's so true. That's so true. I mean, you're spot on. And burnout is real. And a lot of times people experience burnout because they get so discouraged on this journey. And so, we talk a lot about burnout from overexertion or, because we've put so much into it. But I mean, you are spot on. Burnout also happens when we get discouraged and we get so worked up with wanting change to happen. And it's not there before us. And so, Gina, last words.
I just want to say, so I coined the word nonprofit base. So that just refers to me, it's not just for women, it's for all of us newer people that are stepping into the nonprofit sector, disrupting it, changing the aesthetics of it, because for so long, nonprofit, when you think of nonprofit, you did not think of people who looked like us. Not women, not Black people, not other persons of color, but now we are in this space, and we have to continue to support each other as organizational leaders, because a lot of other, a lot of these big organizations and things, they gatekeep. They could be doing so much more, have so much more, but they still are scared to let us in, to bring us into that fold. So we always have to support each other on this nonprofit journey, and share any information or anything that we get along the way. And like Dionne said, burnout is real. We'll be 5 years old in April, and I just finally hired a grant writer to take over the grants, because for 5 years, I've literally written every grant that we've ever gotten. And I'm like, okay, I'm not so much burned out yet, but I don't want to wait until I get burned out. And then nothing happens anymore. Everything comes to a halt. So I hired a grant writer and I hired a website manager, because I created the website, I managed the website, and it's like, okay, you need to, let go of those reins and let somebody else do it so that you can focus on other things. I think, Dionne, you mentioned like talking to the medical students while they're in school. So I do that a lot. I go and talk to the UNLV school medical students and the public health students. And it just comes from networking and building relationships. So like here we have the Minority Health and Equity Coalition, which is a nonprofit arm of the Office of Minority Health. So I'm on the board, and it sits under the UNLV School of Public Health. So being on that board, I'm able to meet other organizations, and it allowed me to move into being able to just go to the university and talk to them about sickle cell. And I give them the patient perspective. I bring a patient, hematologist, and then I talk about the caregiver and the community perspective and the health disparities and things like that, because they're not going to get it from their medical books. It's not in there. It's like a sentence or two. And from that, I've been invited to come to other universities here to talk about sickle cell. So it's just kind of putting yourself out there. I was able to educate 200 of the Clark County school nurses, just because advocating for my daughter, because she went to school, making sure she had her 504 plan and such, let them know what I did about the book. And I said, hey, I'm open to come to the school and talk to the nurse and give her information about sickle cell. And the director of all the nurses was like, hey, you can come to our staff development day and educate all our nurses, and we got a pharmaceutical company who paid for the food. And because it was facilitated by a nurse practitioner or a physician, all those nurses were able to get CEU credits. So of course they showed up. So there's just different things you can do. You don't have to talk to somebody like way up the food chain to be able to get into those organizations. You just have to make those relationships, put yourself out there, network, and you can do it. Like all the stuff that I did, I didn't know anybody when I moved here. I just, put myself out there for a lot of the opportunities. So people were like, oh, you got to know this person, you got to know that person. Sometimes you do, but sometimes just being you and doing what you do, your passion, it'll open doors for you.
Yeah. And I think that's a great way to end this episode. I think one thing that you said for sure is acknowledging that we are in this space and we're not going anywhere.
Here now.
We crossed over in this space as our authentic selves. This is who you get, and that's one thing that I'm always trying to make sure I remain organic and authentic. You gonna hear my Southern, born and raised in Alabama. Like you're going to hear that, because that's who I am. And I think like you said, Gina, that's the only way to fully build quality relationships, when you walk into them as your authentic self. And so, man, I appreciate y'all so much for being a part of this conversation. To our listeners, I will put ways to connect with Dionne, Gina, and Stacey in the description of this podcast episode, so you'll know how to reach them. All three of them are on social media, so you'll be able to reach out on your own to build those relationships and connect. As always, you can always reach out to Being Rare. We're happy to spark those conversations for you. Until the next episode, be rare. Thank y'all again so much for hanging out with me these past, 2 hours. I don't even know how long we've been talking. So thank y'all so much.
Thank you.
Yes, thank you.
Thank you for listening to today's episode. If you enjoyed today's conversation, please share it with others, post it on social media, or leave us a comment or review. Stay up to date on current conversations by subscribing to Being Rare wherever you listen to your podcast. Connect with us on social media at Sarita Edwards at the Being Rare Podcast. Until the next episode, be rare.